Hi everyone, welcome to Nursing Guru. Myself Naina, and today I am dealing with the topic antenatal care. I will discuss what all are the purposes, what is its aim and its definition, and what all are the things that are included in the antenatal care, and regarding what all are the health education or exercises that is involved in this. Let's begin. So, what is antenatal care? That is its definition. Antenatal care is the systemic supervision or the observation, evaluation or the advice that is given to a lady during her pregnancy period. That is the antenatal period. That is what actually antenatal care means. It is the care, that is the supervision, the observation that is giving continuously to a pregnant lady. That is the antenatal care. Let's discuss what is the objectives of antenatal care. The main or the major objective of antenatal care is to ensure healthy delivery of a healthy mother or to deliver a healthy baby from a healthy mother without any complications in the pregnancy or during the antenatal period. That is actually the objective of antenatal care. Then what all are the aims or the purposes of the antenatal care? The main purpose or the major purpose that include is to screen high risk cases. That is, in or during the time of pregnancy, the patient, that is a mother, may feel a lot of complications or lot of risk chances is more. So in order to screen the high risk cases, we can do this antenatal care. And the second one, that is to provide health education to the mother as well as the father, that is to the couple, regarding the time, the place and the mode of delivery, and also to educate the couple regarding the medical termination of pregnancy plans, and also regarding the family planning programs, and also regarding use of contraceptive methods and the spacing methods. Detailed health education could be given about this topic to the family members or the couple. And the next one, that is to prevent, to detect and treat complications at its earliest. That is, before getting into any complicated or risk cases, before that we can just screen the risk, and also we can detect, diagnose and treat the complications at its earliest. Then also to explain the physiology, normal labor physiology, and regarding the lactation and how to care the newborn after delivery. These things can be taught to the parent or the mother by or through this antenatal care. And the other most important purpose of this antenatal care that include providing continued risk assessment, that is to ensure continued risk assessment and to provide primary preventive care to the mother as well as to the child or to the newborn baby. That is the main objective or the main purpose or the main aim of this antenatal care. So let's discuss what all are the things that is included in the antenatal care. The first thing that we should do is antenatal registration. Even first, if we know the mother or the lady is pregnant, first of all we should do the antenatal registration. Second thing we have to do is detailed history collection. All or entire detailed history of the mother or the pregnant lady should be collected. And the third one is thorough antenatal or gynec or obstetric examination of the pregnant lady. We should do a thorough antenatal examination of the pregnant lady in order to assess any risk or screen for the complications. And the next, another component of the antenatal care that include the lab investigation. After history collection, if there is any problem associated with pregnancy, then we have to go for the lab investigation and find any complications. Then the last thing, that is health education. Provide health education to the family, both the mother as well as the father, regarding the newborn care, the pregnancy, lactation, family planning and medical termination of pregnancy. All these things should be taught to the parent. First, as I told, we have to do the antenatal registration. Second thing is the history collection. We should collect a detailed history from the pregnant lady or the mother. That should include the particular history of that pregnant lady, the family history, the medical history, the drug history, that is if the patient is having allergy to any drugs or if the patient is having addiction to any drugs, that should be checked or assessed from the patient or the pregnant lady. Then we should go for the marital history, then go for the contraceptive history, and also we should check whether the patient is having any allergy to food items. And the most important thing that should be included in history collection is the menstrual history. So the detailed history collection from the pregnant lady, her marital history, her menstrual history, her medical history, surgical history, family history, socio-economic status, these things should be included in the history collection. Then as I told earlier, then we should go for the thorough antenatal examination. Before going to the antenatal examination, we should know when or at what old time we should go for an antenatal checkup or an antenatal care. Mainly there are 4 things or 4 times that we can go for an antenatal checkup. That is first, second, 3, third and fourth one. Mainly 4 times antenatal checkup or antenatal care or antenatal visit can be done. The first visit that is done usually in the 16th week. That is first 16th week we have to go for the first visit. And the second antenatal care or antenatal visit is done at the 24th to 26th or 24th to 28th week, we will go for the second visit. The third visit that is usually done in the 32 week, we will go for the third visit, and the last 4th antenatal visit is usually done at the 36th week. These are the 4 times we should go for an antenatal visit. And as I told earlier, in the first visit, we should go once in a week. We should go for the antenatal checkup once in a week. The second visit is usually twice in a month. We should go for twice in a month. And the final, the last till the delivery, we should go weekly for the antenatal care or the antenatal checkup. We should go weekly to the antenatal clinic. That is regarding the antenatal visit and the antenatal care. Then we will discuss about the antenatal examination or obstetrical examination. As I told, we are going to discuss about the antenatal care, that is the physical examination that is done usually for antenatal examination or obstetrical examination. And the physical examination include, we should check the height of the pregnant lady, the weight of the pregnant lady, and also we should check whether the pregnant lady is having any pallor. Pallor can be assessed in the oral mucosa, in the palms, in the conjunctiva and even in the nail buds. So there we should assess whether the pregnant lady is having any sort of pallor that will be helpful to understand whether that lady is having anemia or related conditions. Then we should check whether that pregnant lady is having normal vital signs. That is, vital signs of the pregnant woman should be assessed. That include the respiratory rate, that is about 18 to 20 breath per minute. That is normal, 18 to 20 breath per minute in a pregnant lady. Then we should check the pulse, that is 60 to 90 beats per minute. And also we should assess the temperature, whether the patient is having any hypothermic reaction or hypothermia like problems. So the vital signs should be thoroughly assessed, that is of the pregnant lady. Then we will go for the abdominal examination or abdominal assessment. In the abdominal assessment of an antenatal mother, we should check the fundal height of the mother. Fundal height, then we should check the fetal heart sound. That is the first and foremost thing, we should check the fetal heart sound in order to assess whether the baby is having any complications or any associated risk or difficulties. For that we should check the fetal heart sound. Then we should check the fetal presentation, fetal lie and fetal position. That should be also assessed in the abdominal examination or in the antenatal care. Then, as I told earlier, we are having 4 visits. So, the first visit we will do the physical examination or the antenatal examination, history collection and antenatal registration. Then comes to the second visit where we have to check the detailed examination of the fetal heart sound, that is FSH, fetal heart sound should be detailedly assessed. Then we should check or we can assess whether that lady is having multiple or twin pregnancy. Then come to the third antenatal visit. In the third antenatal visit, we can assess whether that pregnant lady is having pregnancy related complications, that is preeclampsia or anemia. These conditions or multiple pregnancy, these conditions can be assessed in the third visit. Then the last one, that is the fourth visit. Fourth visit is usually done in the 36th week of antenatal period or the pregnancy. In that period, that is in the fourth visit or in the 36th week, we will check the presentation, the lie and the position, and also from there or in that visit we usually start the birth plan, that is how the delivery is planned, either cesarean is needed or normal delivery is what we are focusing on. That is regarding antenatal care and the antenatal visits. Then we will discuss about how much kilocalorie or what are the extra calorie requirement of a pregnant lady and a lactating mother. Usually for a pregnant lady, we should provide 300 kilocalorie. Additionally, we should provide 300 kilocalorie of food in a diet. Similarly, in case of a lactating woman, it will be doubled. That is, we should provide 600 kilocalorie of food in their diet. This is the normal requirement of additional requirement of a pregnant lady regarding their diet. As I told earlier about the additional requirement of calorie in a pregnant woman. Similarly, there is a requirement for iron during antenatal period. That is, in the 20th week of pregnancy, usually iron supplement is given to the antenatal lady or the pregnant lady. That is, in the 20th week, usually iron supplementation is given. Next, we will discuss in detail about what all are the antenatal exercises or antenatal hygienic measures that we should follow. The antenatal hygienic measures, that is mainly including or the health education that should be given to the pregnant lady or the antenatal mother, that is included in this, which involves, first of all, we should ensure the patient is maintaining hygiene, or the pregnant lady or the antenatal mother is maintaining hygiene. Advise them to take bath daily and maintain personal hygiene. That will be helpful not only to the mother but also to the fetus or the growing infant. Then regarding bowel care, there is an increased chance for development of constipation in case of pregnancy or antenatal period. So, in order to avoid this antenatal problems like constipation, we should advise them to drink or take adequate fluid, that is included in the bowel care. Advise them to take adequate fluid which is included in the bowel care. Then we should tell them regarding exercises. Proper antenatal exercises should be taught to the pregnant lady that should be done at the time of pregnancy, only with the supervision or only with the advice of their physician or the gynecologist. That should be done by the pregnant lady. Then we should tell them regarding the proper diet. That is, as I told earlier, additional requirement is 300 kilocalorie. So advise them to take proper food in correct amount in the correct time. These all are the measures or the health education that is to be given to the antenatal mother or the pregnant lady. Apart from this, most important thing that should be taught to them, that is regarding the coitus. That is, advise them to avoid coitus during the first trimester of pregnancy. This is the most important thing that we should teach them. So these all are regarding antenatal care and health education that should be given to the pregnant lady or an antenatal mother. Till now we were discussing about antenatal care, what all are its objective, what all are its purpose, and regarding the 4 visits that is included in the antenatal care, and also we learned about detailedly about the health education and the additional diet requirement during pregnancy. I hope you all understood this topic, and if you have any doubts, just leave a comment. Thank you for watching. Bye.